Okay, we can get started. Welcome everybody to the next edition of the Good Hormone Health webinar. Today's a very exciting topic entitled Compounded Semaglutide Tirzepatide, brand names Ozempic and Mounjaro for patients with endocrine problems. Welcome everybody on this Zoom and on Facebook. Our outline tonight is why we should focus on health and wellness, who should go on weight loss medicines, which weight loss medicines are the best, what are the side effects, how do they work with diet and exercise, why is Dr. Friedman recommending compounded medications, how do you work with Dr. Friedman's office to get the compounded medications, and there'll be opportunities for people that are on these medicines and have questions to share their experience on Facebook as well as on Zoom. So my approach to weight loss is to rule out any endocrine problems, and many of my patients have these problems, such as hypothyroidism and Cushing's syndrome, or growth hormone deficiency that may lead to weight gain. Simultaneously, I encourage my patients to eat a healthy, plant-based, low-carb diet. I recommend really eating a lot of vegetables. I have my Vegetable Revolution diet, and people can get that on my website, or I can send it to people if they're interested. Vegetables are low in calories with a good amount of nutrition. And I think there's a lot of controversies in nutrition, but I think everybody agrees that vegetables are healthy for people. So I really encourage people to eat a lot of vegetables. I encourage people to move, be as active as you can, try to get as much exercise. The other things I encourage people to do is to get a good night's sleep, have good mental health, be out in nature, avoid stress, which is very hard to do. If you can't do that, at least don't let stress bother you, and maintain good relationships. But everybody says I've done all that. Most of my patients already have a healthy diet and exercise, and many patients need a jump start for weight loss, and this is where weight loss medications come into play. Weight loss medicines can often reduce food cravings. Food cravings lead people to eat unhealthy foods and make it harder to follow a healthy diet. So I often prescribe weight loss medications after other endocrine conditions are diagnosed and treated. Um, I go to the annual Endocrine Society. I've been here going every year since 1990. And at the one in 2022, it was pointed out that only 2% of patients with obesity are on weight loss medications. Imagine if only 2% of patients with diabetes are on diabetes medicines, or 2% of people with high blood pressure were on antihypertension medicines. What are the reasons why for this? One is doctors don't prescribe them. Two is doctors and other providers have an unrealistic view that if obese patients have more willpower, they could lose weight on their own. The third issue is cost. The fourth issue, which is becoming more important, is lack of insurance coverage and difficult pre-authorization requirements. And the last one is side effects. I'm going to briefly summarize the different types of weight loss medicines, and we're going to concentrate on the GLP-1 receptor agonists. The stimulants, I'm going to mainly talk about phentermine today. They're related to amphetamine, phentermine, phendimetrazine, tenuate, phentermine, topiramate, called Casima. These are medicines that have certainly a role in obesity management and weight loss. I do use these a good portion of the time. Next is the GLP-1 receptor agonists, which we're going to talk mainly about today. These were originally diabetes drugs, and I'll go over a little bit about the history of how they were discovered. The main one is called Ozempic or semaglutide. Rybelsus is an oral version of semaglutide. I don't find that helpful. Wegovy is a version of semaglutide that is for weight loss, while Ozempic and Rybelsus are for diabetes. Mounjaro comes as two flavors: Tirzepatide, which is used for diabetes, and Zepbound, which is used for weight loss. These are GLP-1 dual receptor agonists. I'll explain what that means. Another one is called liraglutide, and then the other one is called dulaglutide or Trulicity. Liraglutide is also called Victoza or Saxenda. These do not work usually as well as Ozempic, and they're less popular. There's a medicine called Contrave, which is naltrexone plus bupropion. There's Orlistat or Ollie that helps people poop out their extra fat. It doesn't work too well and gives a lot of side effects. And then there's Belvix that was removed from the market in 2020 due to high risk of cancer. So phentermine is also called Adipex P or Suprenza. It was part of the fen-phen. The fenfluramine was removed from the market due to heart and lung problems, but the phentermine has been used for, I would say now 60 years and is safe. It comes in 50 milligram tablet, 15, 30, or 37.5 milligram tablets or capsules. It's very expensive. It's about $1 a pill, basically $40 a month for the 37.5 milligram pill. So the cost is really not much of an issue. It's only approved for short-term use. And usually 2 to 4 months. However, many people do fine on it and can stay on it for longer and still get some benefit. It decreases appetite and may have some effects on increasing metabolism. It's in the family of amphetamine-like drugs. Common side effects are hyperagility, rapid heartbeat, increased blood pressure, trouble sleeping, and urinary retention. It works fairly well, at least for a short period of time at a low cost. I usually give a half a pill before lunch and dinner. If people get insomnia, I move it to earlier in the day. The long-term use is not firmly established, but I usually give this for a period of 2 to 6 months. Some people, I have them take a holiday from the Ozempic-like medicines and give this in between, and then their bodies reset for a new batch of being on the Ozempic. So now we're going to talk about the GLP-1 receptor agonists. These are called incretins. This was discovered around 1960 that oral glucose raises insulin more than IV insulin. I thought there was a GI factor, a gastrointestinal factor, that secretes insulin. And back in the 1960s, there were two of them discovered. One was called GLP-1, and one was called GIP-1. As the years go by, and I did some of the research on this in my lab, working on pro-glucagon that's metabolized to glucagon and GLP-1. And it was found that there are GLP-1 receptors in the brain that do control appetite. So the two medicines or two main medicines for this area, one is semaglutide. It's a GLP-1 receptor agonist. There's Ozempic for diabetes and Wegovy for obesity. Rybelsus is the oral version of Ozempic for diabetes, not used that much. Tirzepatide is a dual GLP-1 and GIP receptor agonist. It means it affects both of these hormones and has more profound effects than if it just affected one by itself. Again, Mounjaro is for diabetes, Zepbound is for obesity. The history is really interesting. There was a Wall Street Journal on this. I really liked reading about history, and I wanted to give some background on this. It has two interesting animals, anglerfish and the Gila monster. In 1980, researchers at Mass General Hospital wanted to use new technology to find the gene that code for a hormone called glucagon. They decided to study anglerfish, which has a special organs. Tiffy, can you mute everybody? Maybe there's somebody on Facebook that's making a lot of background noise.
Yeah.
Okay. The team decided to study anglerfish, which have a special organ that makes the hormone and GLP-1, and it simplified the task of gathering pure tissue. They determined the genetic sequence of glucagon and learned that it has the same gene that related hormones known as peptides, especially glucagon. It was called glucagon-like peptide 1. His nickname was GLP-1. A couple years later, scientists in Massachusetts and Europe, especially in Denmark, was a hotbed of research on this, learned that it encourages insulin release and lowers blood sugar. They held out hope it could treat the people with diabetes. Later, it was discovered that GLP-1 made people feel fuller faster and slows down emptying of food from the stomach, so people were able to feel full. But there's a problem. The GLP-1 vanished from the human body as fast as it's secreted. It's degraded by enzymes and washed away into the kidneys in minutes. There was little chance of developing this magic peptide into a drug. So scientists turned to the Gila monster. Gila monsters don't get high or low blood sugars despite eating only 4 meals per year. Most of the time, they live below the ground, and they eat usually 4 mouse or rats per year. They slowly digest the energy stored in their tails, and they don't get low blood sugar or high blood sugar. They're able to, again, eat 4 times a year. So Eng and Rothman studied powdered Gila monster venom. The owner survived 172 snake bites over the years as he produced venom for research. Eng isolated a small peptide from the Gila monster called Extendin-4 that turned out to have a similar structure as GLP-1. Eng then tested his new peptide on diabetic mice and found something intriguing. It not only reduced their blood sugars, but did so for hours. The main symptom was nauseousness. Another prominent researcher named David Nathan led a 1991 study and still remembers when he increased the dose, quote, "One person leaned over the side of the chair and threw up on my shoes," end quote. However, he was not discouraged by this, and the various scientists worked by getting to develop Excedrin 4 into a drug by synthesizing the Gila monster peptide. And the Gila monster peptide was Excedrin 4. So the drug was approved by the FDA in GLP-1, the first GLP-1 in 2005. It was called exenatide. And I used that drug for several of my patients. It didn't work that great. It was a twice-a-day drug initially. It gave people these welts on their stomach. But, it was a sort of a start. They then, people at Novo Nordisk made a drug that was once a day called liraglutide. It got FDA approval in 2010. It was better than exenatide. 7 years later, let's see, so that was in 2010, so it's 2017. It turned out they came up with semaglutide, a once-a-week shot, and it was also a blockbuster drug, and it gave very good effect on weight loss. A higher dose was approved in 2021, Wegovy to treat obesity, and these two drugs are Ozempic and Wegovy. So how does GLP-1 work? In hyperglycemic states, the GLP-1 receptor agonists stimulate insulin secretion and delays gastric emptying. This is the incretin effect. In hyperglycemia or euglycemic states, it suppresses glucagon so you don't get hypoglycemic. It decreases appetite and reduces body weight. This is a schema of this. GLP-1 is secreted upon ingestion of food by the intestine. It promotes satiety and reduces appetite in the brain. The alpha cells, again, I did a lot of research on this. It decreases postprandial glucagon secretion in the liver. It decreases glucagon, it lowers glucagon and reduces hepatic glucose output. In the stomach, it helps regulate gastric emptying. The beta cells, it enhances glucose-dependent insulin secretion. So your beta cells work better, you make more insulin, and your diabetes gets better. So Ozempic or semaglutide is a diabetes medicine that leads to profound and sustained weight loss. It's not an amphetamine-like drug. It's not similar to phentermine or phentermestazine. It has side effects. The main side effect is nauseousness, and people feel full. So therefore, you have to go up very slowly on the dose. Me and most people recommend 0.25 milligrams weekly for a month, then 0.5 milligrams weekly for a month, then 1 milligram weekly. Some patients do fine on a lower dose and have good weight loss on that. Some people need the higher dose. It can go up to 2 milligrams. You think from 1 milligram to 2 milligrams is a big jump, but it's not that bad. I often have people take the 2 milligram dose every 10 days for the first 2 doses and then go up to the 2 milligram dose. And you can also usually get additional diabetes effects and weight loss at the 2 milligram dose. If you go down to if you get nauseous, you can go down to a lower dose. That's, for example, if you're on 0.5, you can go down to 0.25, and we can give the medicine Zofran for nauseousness. And in general, if you're off it for more a month, you restart the lower dose. If off it for less than a month, you can stay on this current dose. The semaglutide, the Ozempic, is the only one that you can use clicks on. The Wegovy, the Mounjaro, the Zepbound, you don't have these click options. That's one reason why I like Ozempic. 18 clicks is 0.25 milligrams. So if you do go develop nauseous, you can go down the clicks. You can go down to 5 clicks, for example, and then go up slowly. You can start at 8 clicks and go up by 5 clicks a week until you're up to the higher dose. The weight loss in general is greater at higher doses, and some people report that men need a higher dose than women. Other side effects include vomiting, diarrhea, and constipation. Ozempic lowers your A1C if you have a high A1C. If you have a normal A1C, it really doesn't do that much for your A1C. So you don't have to worry usually about getting hypoglycemic. It has cardioprotective effects or renal protective effects. It improves PCOS, although it's not approved for PCOS. And you probably can't get your insurance to cover it if you have PCOS, but it does help with PCOS. It also helps very nicely with fatty liver disease or hepatic steatosis. Usually doesn't give low blood sugars. Side effects include nauseousness, feeling full, vomiting, feel like food stuck in your chest, abdominal pain, low appetite, which is what you want, diarrhea, and constipation. So this is a little diagram we show for our county patients. You should store it in the refrigerator. You could do any site, but most people do it in their stomach or their thighs. You can change the sites. If you have any side effects, don't increase your dose and notify your provider. It's once a week. It's non-insulin. You should inject it basically the same day per week, and you can use it with or without medicines. What are the long-term side effects of Ozempic? So as I said, it's been around, I think, since 2017. So it's been around for 7 years. So we don't know the really effect, but so far it seems quite safe. Many, but not all weight loss medicines, such as losartan, and sibutramine, were found to have long-term side effects and pulled from the market. I don't think this will happen with Ozempic. I think it's been around enough, it's been studied enough, and I don't see that people are getting sick from it. In rats, it causes a rare type of thyroid cancer called medullary thyroid cancer. And people, if you have medullary thyroid cancer, which is an extremely rare type of thyroid cancer, most people, if they do have thyroid cancer, it's called papillary thyroid cancer. If you do have medullary thyroid cancer, if you have a relative with that, you shouldn't take it. But even if you have papillary thyroid cancer, most studies have really found that it doesn't increase the rate. There's a few that occasionally that do. They had some methodological concerns, but I think most people feel that it's safe to take, even if you have thyroid cancer. You don't have to monitor yourself. You don't need a thyroid ultrasound. Basically, it's probably not going to affect thyroid cancer. But, in general, I would only take Ozempic if you need it because it potentially could have some side effects. Now, Wegovy and Ozempic are the same drug, but Wegovy is approved for weight loss. It comes in 0.25 milligrams, 0.5 milligrams, 1 milligram, 1.7 milligrams, and 2.4 milligrams. It's a pen. It doesn't allow the partial dosing of the clicks. You should stay on each dose for a month and only go up if you're not experiencing a side effect. There is a huge amount of shortages of these medications. You could try different pharmacies, but basically many pharmacies are completely out of these medicines, especially the Wegovy. The side effects are similar to Ozempic. The next drug is called Tirzepatide. Tirzepatide is called a twin cretin. It's a dual GIP and GLP-1 receptor agonist. And so right now, Tirzepatide is approved for the treatment of diabetes. Its version for obesity is called Zepbound, and it has affects it affects these two GIP peptides, and it does a very good job of lowering your insulin, your glucose, and giving weight loss. So this is a study. I'm not going to go over the details, but we're going to look at the one in the upper right corner here. And you can see semaglutide is in the top bar with the dotted gray lines over here. And the average weight loss from the time of the beginning, people that started with a weight loss of 93.8, the average weight loss was 6.2 kilograms, which is, about 13 or 14 pounds. Those that are on the tirzepatide at the 5 milligram dose lost 7.8 pounds, 7.8 kilograms, about 15 or 16 pounds. Those on the tirzepatide at 10 milligrams lost 10.3 kilograms, about 23 pounds. And those on the 15 milligram dose lost 12.4 kilograms, which is about 30-ish pounds, 28 pounds or so. So this is a huge amount of weight loss that's been reproducible in studies. A large number of people met their target weight loss. Their lipids got better, their body weight got better, their diabetes got better. So this is, it's quite impressive data that especially seems like the tirzepatide, as you can see here, is more impressive than the semaglutide. Both were pretty effective, though. So Mounjaro is the name of tirzepatide. It's a new diabetes drug. Zepbound is the FDA-approved drug for weight loss. Very impressive properties for patients on the highest dose of weight loss up to 25 pounds. It's given once a week like Ozempic, has similar side effects as Ozempic, including nauseousness, diarrhea, decreased appetite, vomiting, constipation, indigestion, and abdominal pain. The doses are 2.5, 5, 7.5, 10, 12.5, or 15 per 0.5 mils. In a single dose pen, patients should try to stay on the same dose for 4 weeks and only go up to higher doses if no side effects are present. And again, just like with the Ozempic, some people do fine on the lower dose and can stay on that. How do they work with diet and exercise? Weight loss medicines curb your appetite, so you put less toxic foods in your body. Eating food is expensive. A lot of junk in most foods that people eat. It's time consuming. So if you can eat less, I think people do better. Allows for a jump start. It decreases cravings, decreases insulin resistance. People feel better with less weight, but independently, it also decreases inflammation. There's been some nice studies how it decreases inflammatory markers. It makes it easier to exercise, and it gives you better gut health. It improves your microbiome. So there's a lot of good reasons to take these medicines. So what's the problem? And, this is the talk I gave a year ago, and now things have changed. Basically, these are expensive medicines. Ozempic, Wegovy, Mounjaro, Zepbound. And basically, insurance are no longer covering them. I would say we get less than 10% of our patients get these covered by their insurance. They say they have good insurance. They say, yes, it's been covered before. Insurance companies are weasels. They want to save money. They don't really care. They sometimes will tell you it needs a pre-auth, but most of the time this pre-auth means you have to jump through a lot of hoops. You have to bid on 3 other different diabetes medicines. You have to have diabetes. For weight loss, you have to go to Weight Watchers or show that you've lost so much weight on it already to continue it. So we're finding that these medicines are just almost never covered. And plus there's shortages of them too. So even if you get it covered, then you can't get it, and then your insurance, the coverage goes away, and then you're stuck without them. So how do you get insurance coverage in 2024? It almost never works, unfortunately. There are shortages. There are some coupons. The coupons aren't that helpful usually. You can potentially get them in Canada, but they're pretty expensive. You can call your insurance to see if they cover weight loss medicines. Many don't. You ask them for the criteria for the coverage and if there is a pre-authorization form. Do you have to have diabetes to get it? In general, we're not finding that saying insulin resistance, pre-diabetes, we used to be able to get away with those, PCOS, none of those seem to work. And if there's no coverage for these medicines, I can't argue with them. If they have their policy don't cover it, I could waste my time and try to do a face-to-face appeal or peer-to-peer appeal, fill out more paperwork. It almost never works. So this is where the compounded semaglutide and tirzepatide comes in, as these are great alternatives at reasonable prices. I've done a lot of research on them, and we'll talk about the options in the next several slides. The other option is phentermine. Phentermine, again, is low cost. It does work fairly well. And if somebody can't get semaglutide or tirzepatide, the phentermine is an option, but many people have tried the phentermine and they haven't been able to tolerate it. How long do you take these weight medicines? Until you get side effects, until you're at your ideal weight. And then I usually taper. If you get coverage for these and tolerate it well, I usually put people on a low dose. The phentermine usually stops working in 3 to 6 months, you could take a holiday and restart it. Most weight loss medicines have some rebound weight gain when they're stopped. Most studies have suggested you gain about half your weight back, which is still okay. You still lost half your weight, even if you have to stop it. So, people gone to, let's say, from 200 to 180, maybe they're going to equilibrate back at 190, which isn't still okay, but you want to obviously keep that weight off. So I've been researching this a lot and contacted several compounding pharmacies and came up with Strive as the compounding pharmacy I'm going to use. Strive has multiple areas around the country. I think they have 6. I'll show that in the next slide. The main reason I like Strive is there's some laws that you can't do compounded pharmacies in California. Most, a good portion of my patients are from California, not everyone, obviously, but some of my patients are from California. So Strive was able to figure out how to prescribe it in California. And it's twice as expensive in California, or it's the same cost, and you get twice as much if you're out of California, if you want to look at it that way. It's pretty reasonable. So basically, it's approximately a 3-month supply for $299, some $100 a month. And, usually if you have to pay for the semaglutide out of your pocket, it's $1,000 a month. So this is, I think, much more reasonable. So there's basically 3 options. The semaglutide itself is for people in California, 2.5 milligrams per mil. We order a 2 ml vial. It has 5 milligrams in it. A typical dose would be 0.25 milligrams a week for 4 weeks, a 0.5 milligram a week for 4 weeks, and then a 1 milligram dose for 2 weeks. So it would be 10 doses per vial. We'd give you a refill. And then, the next time you see me, we can consider going up on the dose in 3 months. And for out of California, there is the semaglutide plus glycine plus B12. They find that the glycine plus the B12 helps decrease the side effects a little bit, helps them with more weight loss. So that one is available for people out of California. It's not available for people in California. And you get 10 milligrams per vial at the same cost. So it really is twice as cost effective. Basically, you could do a similar dosing, 0.25 milligrams weekly for 4 weeks, then 0.5 milligrams weekly for 4 weeks, and then 1 milligram weekly for 7 weeks, or you could do 1 milligram weekly for 3 or 4 weeks, and then go up to the 2 milligram dose. So this, again, is a little bit more, they're all reasonably priced, I think, but this is a little bit more reasonably priced, but that's only for people out of California. And the last one is their tirzepatide, the Mounjaro, the dual incretin. This is more expensive. A 2 ml vial has 20 milligrams of the compound. So you would have, it would last you for 6 weeks. So 2.5 milligrams weekly for 4 weeks, and then 5 milligrams weekly for 2 weeks. And then you get a refill. They do give a little bit of discount. I could maybe give a little bit of discount if you're ordering multiple vials. But I want to keep it sort of simple at this $299 per vial. So how do you pay for them? Do you pay Strive or Dr. Friedman? Right now we're paying me. The charge is $299. You pay by PayPal, and we're going to have a compounded weight loss medicine tab at the bottom of my appointment page on Good Hormone Health, where people can order this and pay this. You'll send the PayPal receipt, which medicines you want in your state, to our general email address, mail@goodhormonehealth.com. When you pay by PayPal, you should note on it that it's for Strive. Once the payment is received, our office will notify the Strive pharmacy to ship it to you. They will confirm your shipping address, and you'll receive the vial that's either the 5 or the 10 milligrams if it's the semaglutide, or the 20 milligrams if it's the Mounjaro, the Tirzepatide. They'll last sort of, again, around 2 to 3 months. And for a refill for the ones that you're paying me, you have to do another PayPal request. Strive ships to 34 states, including California. I tried to alphabetize this. I couldn't really do that conveniently. The 34 states are listed here. These include Puerto Rico, so it's probably 33 states. These are most of the states, but not all the states. And if you don't have that, we can use the Empower Compounding Pharmacy for that one. They also ship, but they don't ship to California, but they do ship to some of the states that Strive doesn't. Let us know if you're in that category. I don't right now know of any place that ship outside the USA. This is the website that lists the locations. But it looks like it's a good portion of the states. Is there a shipping charge? They charge $30. I'm going to include that in the price you pay me. It's shipped overnight. And if you order from Empower Pharmacy, there'll be an extra shipping charge. And the Empower, again, is also more expensive. How long is the vial good after opening? So in general, USP guidelines suggest a multi-use vial should be discarded after 28 days. However, Strive products do maintain a 90-day use beyond opening use. And I feel comfortable ordering a 90-day supply. I don't think it's going to go bad. I think it will still be effective if they're starting to grow some bacteria inside of it or something like that. You probably should get a new one, but I don't think that's going to happen. And you should sort of wipe off the top with a sterile alcohol pad when you use it, and wipe off your stomach with a sterile alcohol pad. Is it commercial semaglutide or compounded? The semaglutide that Strive ships to California is pure semaglutide base, no additives. The product is intended for California. It's manufactured from a 503B pharmacy. It has a specific NDC number. The semaglutide from other sterile locations is the semaglutide base powder with glycine and B12 added. It is a compounded pharma product. So again, the one in California is not really compounded. It's really the same, pure, but the ones from outside are compounded. I don't think that matters that much. Is there quality and purity data? Strive third-party tests each batch of the compounded sterile products before they are dispensed to the patients. They complete random potency testing of various batches throughout the week to ensure quality and the potency remains the same across the board. They have certificates analysis for their APIs and additional documentation from Eagle Analytical regarding sterility and potency. So I do feel this is going to be a high-quality compound. Typical doses would be the 0.25 milligrams once a week for 4 weeks, 0.5 milligram once a week for 4 weeks, the 1 milligram dose for 4 weeks or longer. You can stay on that dose or go up to 1.75 or 2.5 after that. The dose should be reduced if there's side effects. And if appetite suppression occurs at a lower dose, the dose doesn't have to be increased. They do give you a syringe, so the 0.25 milligrams is 0.25 mils. And that's easy to measure out in your syringe, and you can go up and you can go up, and you don't have to go up by the 0.25 dosing here. You can go up by gradient dosing. So you can do 0.35 for a couple of weeks if you prefer. So it's very easy to use. Tirzepatide starts at 2.5 milligrams. You can go to 5 milligrams and 10 milligrams, and the 12.5 and the 15 milligrams are options, but expensive. And the same thing, if appetite suppression occurs at a lower dose, the dose does not need to be increased. Remember, tirzepatide is not currently available in California. How is tirzepatide administered? They provide a insulin syringe that is supplied. Use that. They allow 6 vials per order. I think the tirzepatide, they allow 8 per order. Are there refunds? Neither Strive nor me are able to issue refunds or replacements unless due to third-party shipping issues where the package is lost or damaged, which still might be hard to get a refund of, but you can try. We can try that. For example, if it's shipped by UPS, potentially you can contact UPS. Can it be used if I have diabetes? Yes, for type 2 diabetes. No, for type 1 diabetes. What are the benefits of semaglutide? Decreases appetite and cravings, weight loss, and improved blood sugar control. What are the benefits of tirzepatide? You often get more weight loss than semaglutide. The side effects are similar. What are the side effects and contraindications to semaglutide or tirzepatide? The most common side effects include nauseousness and constipation. Patients also report acid reflux, stomach pain, vomiting, burping, and diarrhea. It should not be used if you or any of your family members have been diagnosed with multiple endocrine neoplasia syndrome type 2, which is a very rare endocrine condition, or medullary thyroid carcinoma, also a very rare condition. Other types of thyroid cancer are okay. What I recommend in terms of semaglutide or tirzepatide diet? These medicines can result in muscle loss. So it's important to consume at least a fair amount of protein. Ride the decrease in cravings, eat healthy, try to get your maximal amount of weight loss you can, and eat a low carb, basically a healthy diet. Eat clean. Okay, so I think we'll open up to patients to share their experience. We can try to mute people. We'll only give people the semaglutide or tirzepatide to established patients. You need to send us your PayPal receipt. The talks and slides are posted will be posted at GoodHormoneHealth.com webinars in a few days, along with the Strive facts and questions FAQ. It's going to be on Facebook, on my YouTube channel. If you are not one of my patients, or if you are one of my patients, haven't seen me in a while, I want to get on one of these medicines, please send a message. We're going to try to start doing podcasts. Tiffy, do you have any information on the podcast you want to share with us now?
Yeah, so after this webinar, it'll be available on all podcast streaming services, so Apple Podcasts, Spotify. The audio version will be available. It's under Good Hormone Health Podcasts.
Right.
So you'll be able to look it up within 24 hours.
Okay, so let's start by having people go in the chat and ask questions. And Tiffy, if you have questions on Facebook.
I have one question so far. Annie said, would you prescribe this for a patient who is not obese but has hyperphagia due to a brain tumor? PT currently has not pituitary function and is on all hormone replacements.
Yeah, I think it would be, and I think we can discuss it the patient's next appointment. It does decrease your appetite if you're eating a lot, and somehow most people eat a lot. Most people with the craniophryngiomas and hyperphagia do gain weight, but if that patient's not gaining weight but still eating unhealthy and the glucose is high, it would be a good option.
Okay, great.
Susan asks, I haven't seen you in a bit. I'm in Portland and have growth hormone deficiency, and 2 years ago I was diagnosed with rheumatoid arthritis. I take Orencia and weight loss is challenging, and Mounjaro interfere with those medicines. I would say no, and it does help with inflammation. That is correct. Both Ozempic and Mounjaro would help with inflammation. It would be good choices for Susan.
Great.
Jason asks, what do you recommend to increase muscle mass other than eating more protein drinks? I've lost so much muscle being on the Ozempic. Yeah, I think eating a fair amount of protein, eating healthy plant-based proteins might be at least as good as animal-based proteins. Exercising, weight-bearing exercises, weightlifting, All those would be good choices. Protein drinks are okay. I'm not that big of a fan of them because some people put, some unhealthy things in them. But if you want to make a protein shake with a lot of vegetables and protein powder, that would be a good choice. Somebody here says, I have chronic constipation. It's safe for me. Empty cells and replacing all hormones. I don't have much hunger. Eat when I have a headache. Um, I don't know. I think it can, in some people, exacerbate constipation. Not everybody, pretty low percentage, maybe about 10%. Um, it really decreases your hunger. So if you don't have much hunger, it may or may not be that helpful. But, I think if people still can cut down what they eat and you have less cravings, it might be a good choice for you. Cindy says you recommend a plant-based diet at the beginning of your talk, but then you said a high-protein diet was best on these meds. I'm assuming this means meat is okay. So I think you could be a high-protein plant-based diet. You could eat a lot of garbanzo beans and lentils. Those things are quite helpful from a lot of people. And So you could still be plant-based, but I think if you're going to eat meat, probably more like chicken and fish and poultry. Red meat is less healthy for people overall, I think. But it depends on your health, overall health. You could probably eat some red meat. Susan says it doesn't appear to strive ships to her state, Massachusetts. The other company we use is called um, Empower. So send us an email and we can do Empower. Empower in general, they charge you, so we can order for you. It's a little more expensive than Strive. And again, it doesn't have Strive only doesn't ship to California. Oh, Strive's the only one that ships to California, but Susan can let us know about ordering it through Empower. And I think also Strive's going to increase their number of states, so we can check back with them. Jason says, has Oz been known to cause hair loss? I haven't seen that much written on that. I would say less likely. When people lose a lot of weight, sometimes their hair gets worse, sort of like a stress reaction. But if you do get hair loss on it, you might want to consider stopping if it's really bad. My daughter is already on Mounjaro, excellent drug for her. Has an upcoming appointment with me in August. Current insurance is paying, but we'll be moving to a new state. Would the compounded dose be the same as the brand name dose? Yes. So basically, you can switch over the compounded dose from the brand dose to the compounded dose. And again, if people's insurance doesn't cover it, it's a good choice for a lot of people.
Right. On
Tiffany,
my
go
end,
ahead.
Valerie asked, are there some cases when Ozempic doesn't work? And if so, what are the other options?
Right. So a percentage of people Ozempic doesn't work in, my guess is maybe a third or a half. Um, so then the option would be Tirzepatide. It may work, or the Mounjaro, it may work in people that the Ozempic doesn't work on. Phentermine may work in people that the Ozempic doesn't work on. And then, people can go up to the maximum dose of Ozempic. If you use these compounding pharmacies, the higher doses are more expensive, but they may work.
Mhm.
Um,
And a follow-up is, why wouldn't Ozempic or um like a medication like that work for someone?
I don't think we know that. I think people have, different variants of the receptors, and maybe your receptors doesn't bind your receptor in your brain as well. That's one choice, so potentially the tirzepatide with the GIP one may work better for people.
Mhm. Okay. Tammy asked, began Mounjaro about 10 weeks ago at 2.5 for pre-diabetic and weight loss. Tried Ozempic first. I didn't like the side effects. I'm not seeing much weight loss. However, I'm getting lots of low glucose readings, especially overnight. So I have not increased the dose from 2.5. Does this sound right?
And this is Mounjaro or Ozempic,
Yeah, Mounjaro.
right? So I would not go up if you're getting low blood sugars.
Mhm.
You might want to go down, like take it every 10 days potentially,
Mhm.
or switch to the Ozempic that has less of effect and potentially has the clicks that you can dose on.
And Ellison on Zoom asked, is there an option to get Tirzepatide in California?
Right. The answer is no right now. Right. So right now the only one for California that I found is through Stride as semaglutide. I think California has some laws either pushed by the drug companies that makes it very difficult to import it, and Stride was able to get around these laws somehow. But right now it's not available. Is the risk of thyroid tumors the same between tirzepatide and semaglutide? I would say yes. I think that the semaglutide's been studied longer, and basically most of the studies don't suggest an increased rate of the tumor. The tirzepatide's hasn't been around as much, hasn't been looked at for the thyroid cancer, but I think it's probably going to be similar. Have you found either of these medicines to impact hormone replacement? Um, sort of only directly. Um, the let's see. So hormone replacement. So, if you lose a lot of weight, your menses can be irregular. Usually if you use a little bit amount of weight, your menses may get more regular. But I don't think they affect hormone replacement. Allison said Red Rock Pharmacy ships those tirzepatide to California, but the forum says they they're not losing weight. Is there not real tirzepatide since you mentioned it can't be shipped to California? That's my guess. I think I tried to look into them. I couldn't really make that much progress on them, finding them, but there potentially are other compounding pharmacies. I haven't exhausted the list. AM says, is there an issue, complication taking Ozempic, semaglutide with thyroid minutes, HRT, and growth hormone? No, I think it's safe with all those.
Okay. Do you have any last questions? Please type them in the box.
Allison asks, I am on antibiotics for chronic lyme because affect my ability to lose weight. I'm week 3 of tirzepatide and lost 1 pound on 2.5. I don't think the antibiotics and the chronic Lyme should affect your ability to respond to tirzepatide. But like I said, some people just don't lose weight. Some people need a higher dose. Sort of depends on where you're starting with. AM says, once you reach an ideal weight, do you wean off or take a smaller dose? I usually recommend a smaller dose. Again, as I said, studies have shown that people gain about half the weight back. So if your insurance covers it and you tolerate it well, let's say you're on Ozempic a milligram, I'm sorry, yeah, 1 milligram, you can go to the 0.25 milligrams dose, for example, and probably stay at your ideal weight. Kimberly asked, does Mounjaro help with PCOS or Cushing's symptoms? I think yes for PCOS. I don't think it's been studied for Cushing's, but I find a lot of my Cushing's patients do really well on it. And my Cushing's patients gained a lot of weight when they developed their Cushing's, so they are often quite overweight, and we treat them with medicines or surgery. The Mounjaro or Ozempic work a nice combination with their other treatment.
Mhm. Annie asks, have you found intranasal oxytocin to help with appetite suppression?
Not really. I think just a little bit. It helps with other issues, other mood issues, for example, and bonding and intimacy. I think that results in weight loss are fairly mild, but some people, it does help. Allison asks, what is the process for tapering off and to help with rebound weight? So again, I would not taper off. I would go to a low dose if your insurance covers it, if you're tolerating it well. So, potentially like a 0.25 milligram dose weekly of Ozempic, or a 1 milligram dose of or a 2.5 milligram dose of the Mounjaro. Any other questions?
Um, I guess a couple more questions.
Allison asks, so you're on tirzepatide definitely, or Ozempic, if maybe it's a cost issue, you might want to stay on Ozempic. Many people also, they change their eating habits. Their stomach, quote unquote, shrinks. They're eating healthy, and then they can stop it. And I've had, several people that have stopped it and stayed lean. But, most of my patients, I try to keep them on like a low dose. I got anxiety from a drug. Would Ozempic be different, or just have to try it? I think you just have to try it again. Sort of, there are similar medicines, but some get side effects from one and not the other. Okay, so I hope everybody enjoyed this. Thank you so much, and I look forward to helping people out with their struggles to stay healthy. And let us know if you want this.
Great, and we got a lot of thank yous on our end.
Right. So again, this will be posted soon and be on a podcast.
And I'll post the podcast to Facebook, so look out for that.
Okay, great.
And awesome.
Okay. Tiffany, send me the information of the podcast again.
I will.